Today, we're going to talk about morning sickness in pregnancy. So, morning sickness is something which happens to almost 70% of the pregnant women. But the good point here is that only 3% of the pregnant females tend to have the symptoms associated with the morning sickness, which needs immediate medical intervention. So, let me tell you that morning sickness, this is a misnomer because this is something that doesn't happen only in the morning. That can happen in the afternoon, in the evening, also sometimes at night. So, exactly morning sickness mein kya hota hai? Morning sickness is that when a pregnant lady have nausea, that nausea can be triggered by some sort of fragrances or some sort of odors, maybe because of spicy food or some kind of food she's eating that she's not able to digest. So, and at times she can even have vomitings. So this is precisely the morning sickness. And it happens somewhere around 9 weeks, but can last, in most of the women, it lasts around 20 weeks and gradually decreases. Having said that, every pregnancy is different and we cannot say that it is going to go completely off by 20 weeks because it is variable. Is this something that can be done to prevent morning sickness or maybe to decrease the symptoms so that we can enjoy our pregnancy? My answer would be absolutely yes.
First thing what you should do is try to eat small, frequent meals instead of eating 3 full meals a day. Say for example, eat every 2 to 3 hours once. Even if it is just a small snack, that's okay because this can help to keep your blood sugar levels stable and thereby prevent nausea. Also, make sure to stay hydrated. Dehydration can make morning sickness worse. So, it's important to drink plenty of fluids throughout the day. Keep sipping on plain water or ginger or lemon water. This can also help to soothe nausea. Second is try to avoid triggers. Certain foods and smells can trigger nausea. So pay attention and find out what triggers your morning sickness and try to avoid them. Third, you can also try taking some food such as some dry toast or ginger tea, ginger candies, peppermint, or you can even try smelling a lemon. These can help to relieve nausea. Fourth is try to get plenty of rest because fatigue or the tiredness can worsen morning sickness. So make sure you are getting enough rest. Take naps whenever you can and try to get a full night's sleep. Lastly, if your morning sickness is severe or it is not settling with all these measures, then please inform your treating doctor. They will examine you and they will prescribe you some medications according to the severity that will help you to manage morning sickness. Remember, every woman's experience with morning sickness is different. What works for one person may not work for another. So be patient and try different strategies to find what works best for you. Managing morning sickness during pregnancy can be challenging, but it's not impossible.